Thank you, Mr. Speaker. Colleagues, today I'm proud to present SB 5526 today, which is the budget bill for the Department of Human Services. DHS supports children, families, seniors, people with disabilities, and individuals with intellectual and developmental disabilities by providing services through over 11,000 staff members, 170 field offices, and many community partners. The Joint Committee on Ways and Means approved a budget of $23 billion in total funds, which includes $7.4 billion in the general fund and 11,351 positions. The general fund budget is $1.3 billion, or a 21.8% increase, which largely reflects growth in the current service level budget related to caseload growth, bargained wages and rates, and a declining federal Medicaid match. The investments in this budget support working families, seniors, and people with disabilities in a time of significant economic constraints and challenges. Colleagues, similar to the OHA bill previously that I talked about on this floor, I'll go through each of the program areas in this bill, starting with self-sufficiency. So in self-sufficiency, we have a couple of items I wanted to highlight, starting with youth homelessness prevention and intervention services. This is an ongoing investment in housing stability and support services for youth experiencing homelessness. These grants will support emergency shelter, transitional housing, host homes, and direct cash transfers. This increase in general fund of $19.7 million is an increase of 233% to the program's budget. We also are including a SNAP application accessibility for seniors and people with disabilities to strengthen the social services net and access to food amid a potential growth recession. We want to make sure that our older adults and people with disabilities have a streamlined SNAP application process. In the child welfare section, we have 3 items I wanted to flag. We are moving towards ending the practice of sending children, predominantly kids of color, kids with disabilities, and kids with severe mental and behavioral health needs to hotels without access to essential behavioral health services. So this budget invests $10 million in ongoing dollars to support efforts to reduce agency reliance on hotel lodging when foster youth are temporarily displaced, to continue to prevent temporary lodging in the future. We also are investing $7 million in the Family First Prevention program. We all know that prevention is key to support the continued implementation of evidence-based programs designed to prevent child welfare involvement. And $2.4 million general fund to increase provider payments for the independent living program. And colleagues, this is for foster youth to provide them a path to housing stability. In the Aging and People with Disabilities program, we are shifting $18 million of general fund costs to the Quality Care Fund on a one-time basis. And although long-term care facilities are heavily regulated, significant safety issues prevail. And so to address safety and regulatory oversight, we are investing $1.3 million general fund and 19 positions to conduct more timely inspections of new licensed facilities and those that experience a change of ownership. We are also investing $56.9 million general fund to launch a new service delivery model called Agency with Choice in the APD and IDD programs in accordance with previous bills passed here on this floor. And I'm excited to share a few of the rate increases that I know several of you have been interested and working with us on, starting with adult foster home rate increases and a methodology change. We're providing $2.2 million general fund, $59.4 million total funds to implement an acuity-based rate methodology effective January 1, 2026 for adult foster homes. We're also providing a 21% provider rate increase, and these rate increases are intended to align APD adult foster home rates with IDD adult foster home rates. We are also excited to invest $19.4 million general fund, $53 million total funds for provider rate increases in community-based care, and $33.2 million general fund and $90 million total funds for IDD provider rate increases in IDD, the Intellectual and Developmental Disabilities program area. A couple more I want to share before we close out. We are making additional investments in Oregon Eligibility Partnership and central shared and state assessments and enterprise-wide costs to continue to modernize our mainframe for ongoing planning and transition programs to transition programs off the outmodeled mainframe and onto a one system or other procured options. And colleagues, I know we heard, perhaps you did as well, directly from workers at DHS offices about their safety concerns as they were experiencing in their workplaces. We are investing ongoing funds for facility improvements, $1 million, and security and outreach contracts, $4 million, to ensure the safety and security of customers and staff at various DHS offices. So I know this was a long carry again with lots of investments in here, but to recap, colleagues, this $23 billion budget for the Department of Human Services invests in many of the significant issues in our social and healthcare systems: facility safety and regulation, healthcare access for seniors and people with disabilities, safe homes for foster youth, addressing youth homelessness, and provider rates and fair wages for care workers. I'll share a little bit of the thank yous in my closing, but colleagues, I urge an aye vote.